Welcome everyone. I'm Erin Ryan from the Massachusetts Health Connector. I will be facilitating today's session. I'm joined by my colleagues Seamus Kelly and Nikki Conti, and we are here to help answer any questions you might have. I would like to take a moment to thank chambers, business organizations, and brokers across the state for their support in promoting this webinar. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been disabled. The presentation portion will last approximately 25 to 30 minutes. Then we'll have time for a question and answer period at the end. If you would like to ask a question at any time, please use the Q&A functionality. We will be monitoring your questions throughout. Please do not disclose any personal information or protected health information when you ask your question. We will not be able to answer those in full detail on the webinar. If you have specific personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's customer service centers and instructions on how to find local help from a broker or a navigator. We are recording today's webinar. Following today's presentation, you'll receive an email with the presentation, so there's no need to take detailed notes. So with no other updates, let's go ahead and get started. Seamus, I'll hand it over to you.
Great, thank you, Erin. My name is Seamus Kelly, and I'm here from the Health Connector for Business. And I will be going through this presentation along with my colleague, Nikki Conti. So what is the Health Connector? Thank you, Erin. So the Health Connector is the state's health insurance marketplace. It's a place where individuals, families, small employers can come to find health insurance coverage, both medical and dental. Businesses can come to us and offer it to their employees if they're a business with fewer than 50 employees. People that don't get a health insurance through their job can come through us on the individual marketplace. And many people who apply for help can get savings through the American Rescue Plan, as well as other sort of subsidies that the Connector offers on the individual side. And in recent years, we've seen quite a spike on the business side of businesses coming in to purchase dental insurance through us. We have all the leading carriers are sold through us. So Blue Cross Blue Shield, Harvard Pilgrim, Fallon Health, BMC Health Net Plan, Health New England, Tufts, Always, United, Delta Dental, and Altus Dental. So we have them all here on our shelf with comparison shopping. Okay, so the benefits of purchasing through the Health Connector for Business really allows employers to maximize access and affordability. They can achieve these goals through a range of ways to buy through us, where we have flexibility, choice, savings opportunities. So we have the full carrier participation, which we just showed. We have competitive premiums, and we'll show where businesses are able to save significant money by purchasing through us. We have a wellness rebate, and this is money that goes back to employers if their employees participate in our wellness program. And we've tried to make it a very simple program with over 30 approved activities that employees can do. We have flexible employee choice models, which allows employers to sort of select a benchmark plan and let employees buy up or down, but keeping the costs under control for the employer. We have over 470 certified brokers that are able to help employers. And all of our plans meet all the federal and state requirements. Purchasing through us through the Health Connector for Business, groups can set up a health savings account. So this is a tax advantage medical savings account available to taxpayers in the United States who are enrolled in a high deductible health plan. Each one of our carriers offers a silver HSA plan. So if you want to set up an HSA, you can purchase through us and get one of the silver HSA plans that our carriers have. We do have PPOs that allow you to get out-of-state coverage. So we know we have employers who are located with, near the borders of Massachusetts, where they've got employees living in other states. So we do have PPOs that are offered, and these are offered through our one carrier model. And then again, it's coverage that you can trust. It meets all of the state and federal standards with our minimal credible coverage here in Massachusetts. And they get reviewed every year through our annual seal of approval. These are all the covered benefits that meets the state's minimum coverage standard that we have. So office visits, emergency services, hospitalization, maternity and newborn care, preventative services with zero cost sharing, pediatric care, prescription drugs, rehabilitation services, lab services, mental health, and substance abuse treatment. What are employers experiencing with the Health Connector for Business? We have seen consistent savings across the platinum, gold, silver, and bronze tiers, averaging about 20% for all employers who purchase through the Health Connector for Business. And this is before they see any sort of rebates, so the wellness that we talked about, and get into the small business tax credit as we go along. So we are seeing significant savings for businesses that purchase through us versus off exchange. It looks like our businesses have saved a totaling $9 million across all the businesses that purchase through us by just being through the connector as opposed to going off on their own. Okay, so employers have a number of things that can assist them by buying through us. One is the flexible choices. So we offer employee choice models where we offer one carrier, one level, or one plan option, which allows the employers to decide what they're going to offer, and employees can buy up or down across the tiers or within the carrier through the one choice model. ConnectWell for employers with 1 to 25 enrolled employees, eligible for a rebate of up to 15% on the employer contribution to the health plan if 33% of their employees complete one of our approved activities. So that is money that goes directly back to the employer. The employer can decide what they want to do with it, share it with the employees, keep it for themselves, and the employees will receive a gift card for participating through the connector. We have the small business healthcare tax credit, which is a federal tax credit offered to businesses that purchase through an exchange such as the Health Connector. And we do not charge any fees or membership dues. It's free for anybody to come in. Okay, so I've talked a little bit about the choice models. I've referenced them, but we'll go into these in a little more detail. So with employee choice models, employers are able to set a certain amount of contribution that they're going to provide, and then employees can go off and pick a different plan if they'd like. It also allows for easy comparing options and choosing a plan that fits best for the employer and their employees. So these are the three options: one plan, one carrier, and one level. One plan is sort of the conventional often offers that a lot of businesses have, where the employer selects the plan and the employee enrolls into it. The composite billing is the way we do the charging. And this is where you can also find our bronze plans. One carrier is where the employer selects that they're going to offer a specific plan to the employees from one particular carrier, and then the employees can choose among the different plan options that carrier has. This is done through list billing, so everybody is charged based on their individual ages, and this is where you can find PPOs. The exception of Tufts Direct, BMC, and Found, all the other carriers will offer a PPO. So that if you have a client or you're a business that wants to get a PPO, going through the one carrier model is where you would find that. And then one level is where an employer contributes to a certain plan on, say, the Silver platform, and the employees can buy a more expensive plan on Silver, or they can buy a less expensive plan on Silver. And it's done through list billing again, so it's age-based. And this allows the most flexibility of seeing all the different options available to employees. Okay, so how one plan works. We use a pizza analogy. So imagine you and your employees are going to share the cost of a pizza. You decide on a $10 pepperoni pizza from one pizzeria and agree to pay for half the cost. You pay half the cost of $5 and the employees pay the other half, which would be $5, and that's what's available. And on one plan, the employer selects one health plan, all the employees enroll into it, composite billing happens, and it's available through the platinum, gold, silver, and bronze options. How one carrier works: you, the employer, choose one pizza shop in this instance, and you agree to pay half the cost of a $10 pepperoni pizza from that shop, making your cost $5. For the employees, they can either choose to keep that particular pepperoni pizza or choose a different style pizza from that same shop, but no matter what, you'll still pay $5 towards it. You will see on the bill they're being charged for the other plan that they choose, be a more expensive one or a less expensive one, but you will still see on your bill that you should pay the $5. One carrier, so the employer picks the platinum, gold, or silver plan, and then the employees can buy up or down. This is also done through list billing, which I mentioned earlier, so everybody's charged their own individual rate. Okay, one level, again, using our pizza analogy. You, the employer, choose one type of pizza, say pepperoni pizza, and using the cost of the pepperoni pizza from one pizza shop as the benchmark, you agree to pay half the cost, $5, towards the pepperoni pizza that your employees want. Your employee can then go in and choose a pepperoni pizza from any pizza shop. No matter which pizza shop the employee chooses to get their pizza from, you'll still pay the $5 towards their pizza. So we do this through the gold and silver. The employer selects the meta level and a reference plan within that level to use as a cost benchmark. The employee can then go choose a health plan offered by any other carrier within that selected meta level, and this is done through list billing. So to bring it more back to the carrier, you as an employer would say, for example, I'm going to contribute 50% of the cost of a silver plan offered through Harvard Pilgrim Healthcare. Employees can go in, log in, and buy a more expensive silver plan offered through a different carrier, or go down and buy a less expensive silver offered through a different carrier. You would still pay towards that cost of the original plan, and the employees could recoup the savings. Or if they get a more expensive one, they'll pay more. ConnectWell. So to qualify for ConnectWell, you have to have fewer than 25 enrolled employees, and there are more than 30 qualifying wellness activities that your employees can submit, and then you'll get the funds back. So employers would receive a 15% rebate on their contributions towards the premiums if 33% of employees participate in the wellness activity. And they have the course of the year to do that, and then they submit their documentation, and then we'll send a refund check off to the employer. The average refund check last year was $3,674.79. And then to incentivize employees to submit the documentation who participate, we'll give them a $100 Visa gift card. There are a number of activities you can do. There's mind, body, money. So there's volunteering, there's meditation, things like acupuncture, chiropractor, yoga, things that your employees may already be doing. They're on the sort of body thing if they participate in a charity run or walk, gym memberships, a bike share program, weight management, wellness visits, community gardening. They just need to submit the documentation. And then we've expanded it in recent years to sort of personal finance, so financial literacy, retirement planning, home buying classes, student loan planning, end of life planning. As long as they submit these approved documents, you will get a refund back. So groups are automatically eligible for the ConnectWell program. They get information emailed to them 10 days after the plan starts. Over the course of the year, the employees are emailed information to remind them to participate, how to participate. Employees then complete the list of activities, submit proof. They then will receive a $100 Visa gift card from us. Once they receive the 33% participation rate, we'll reach out to you, or you could contact the call center, and then we will start processing your rebate, 15% of the total amount of contribution the employer made at the end of the year, and then that will get sent out to you. This is a picture of a business that a few years ago got a little over $4,000, and they didn't think they were going to get it, but once everybody participated, the check went out and we were able to get them some money. Small business healthcare tax credit. Okay, so the small business healthcare tax credit is a federal tax credit where businesses may be eligible to receive a 50% tax credit if they purchase coverage through the Health Connector. So that's important. It has to be purchasing coverage through us in order to businesses to claim it. If you cover at least 50% of the cost of a single healthcare coverage for each employee, you have fewer than 25 full-time equivalent employees, and those employees have average wages of less than about $53,000. You'd be able to qualify, and the tax credit is highest for employers with fewer than 10 employees who are paid an average of $25,000 or less. The smaller the business, the bigger the credit. We don't administer this. This is administered obviously through the IRS. So you would need to speak with your accountant or tax preparer to see if your business is eligible at the end of the year. But just by buying through us, if you meet these basic criteria, your accountant should be able to work with you to get you claim the credit. How to get started. Okay. So everything is done online. The employer will create an account. They'll enter in the information about their business. They'll then select a plan, which the deadline to do that each month is the 10th. Then employees can go in and they'll either enroll or waive coverage. Again, it's all done online. That's done by the 20th. And then they must make a payment by the 23rd, their binder payment, and then coverage begins at the 1st of the following month. Just go back real quick. So again, like I mentioned, this is all online. So it's important for employees to go in and enroll or waive, even if they're not going to get, they don't want coverage. If they waive it, that will preserve them with the ability to come in at some point during the course of the year for a special enrollment period if they do need coverage. We have over 470 brokers who can help you navigate the options. This can be pretty intimidating. There's a lot of plans available. You can go the route of the one level, the one carrier, or the one plan. So brokers can really help you navigate your options. They're free. They will not charge you for anything. They get a commission later on from us. There's a cost estimator that brokers can use, so you don't have to enter in everything about your business. You can get a quote up front. They can help you understand your plan options, what's probably the best plan for your group. And many of our most active brokers can help you save time because they understand how how the system works, they understand what's important to you, and they can move things along quickly. Okay, Nikki, do you want to jump in here, or should I continue with this? We're at the sole proprietor part.
Sure. Hi, Seamus. Hi, everyone. Happy to jump in here.
Great, thanks.
So when you're looking at this section here, this slide, Seamus talked a lot about Health Connector for business plans, but I want to kind of level set for everybody and say that regardless of where you get, regardless of which way you come to the Health Connector, whether you're buying a Health Connector for a business plan, or if you're buying a plan because you're an individual or family, I want to just make sure everyone's aware that all the plans that are sold through us meet state and federal standards for coverage. So I'll give you a little bit of kind of insurance speak for just for a moment, but all of the health plans on our product shelf are known as qualified health plans, and all of our dental plans are known as qualified dental plans. So you can rest assured that they meet standards. You would not be penalized for having coverage, having that coverage. Now, depending on where you live, you're going to be able to choose from a variety of plans from leading insurance companies in Massachusetts. And I think Seamus went through all the different carriers that are available through the state's Health Connector. But now I want to specifically kind of move us to thinking about you as a sole proprietor, thinking about you if you need health insurance coverage as an individual or for your family. If you come to mahealthconnector.org, you may be able to qualify for health plans with advanced premium tax credits. Now, this is something that's exclusive to the Health Connector because we are the state's marketplace. So now you could qualify for these tax credits that could help reduce the cost of your monthly premiums. So now more than ever, really, we'd like to encourage people, if you think, oh, well, I would never qualify for that, you know, give these plans a look. In a couple of slides, I will link you to our Get an Estimate. I'll show you the link to the Get an Estimate tool, and you can check it out for yourself and see if in fact you could qualify. Now, another thing that's unique to Massachusetts, our marketplace, are plans that are known as Connector Care. So these are for people who are in lower income brackets who meet other eligibility requirements. And this is great because somebody in this situation might qualify for low or no cost health insurance coverage. Now, in the lower, and I'll talk more about that in further slides. Now, going into the lower left-hand corner, we have catastrophic plans. So I want to just give a little bit of buyer beware here. These are available. We do, in fact, want people to know about them. And you can get these if you are under 30 years of age or if you have a hardship exemption. Now, this can seem attractive to someone if they are, you know, you're price conscious and you're thinking, okay, I'd like to purchase a plan. It will have a lower monthly premium, but you will see higher costs at point of service. So if you do have to go in for a procedure or you are picking up medications, you can expect to pay more at that time. In the center here, you see dental plans. Just very quickly, just noting that we have dental plans available for individuals, for children, families, small employers, etc. And then as Seamus went through in quite a bit of detail, we have Health Connector for business plans. And again, that is for small employers with 50 or fewer full-time employees. So going on to the next slide, I want to talk about something that is specific to the individual and family side. So on our side of the house, we have what's known as open enrollment, and it's a time of year when someone can apply for new coverage for the coming January or renew coverage or shop for a new plan. So during that time frame, you don't need a reason. We're not going to ask you about, why you didn't have coverage, etc. Our open enrollment period is from November 1 through January 23rd. And during that time, you can come in, review the available health plan choices, and make a selection for coverage to start on January 1. Now, if you are watching this webinar, or you have a friend or family member that you know of who needs health insurance coverage, and let's say it's it's September, and you're thinking, oh, do I really need to wait until January? We really encourage people to apply as soon as possible. If you don't have coverage, it may turn out that you have a qualifying event that lets you enroll sooner through a special enrollment period. Now, really, really important for any Health Connector plan product, all our health and our dental coverage can start as early as the first day of the month after you enroll. So coverage always begins, let's say on October 1, November 1, etc. So very, very important. You can't buy coverage and then have it go back. For example, you couldn't shop today and have coverage start on September 1. So going on to the next slide, I just want to talk a little bit about special enrollment periods. So I mentioned this, that if you have a qualifying life event, you can enroll in or change health insurance plans outside the annual open enrollment period. So these are the types of things that let you qualify. So things like a change in your household makeup, an income change, immigration status, if you move to move into Massachusetts or move to a different part of the state. Certain other life changes too, like getting married, having a baby, adopting a child, or even losing job-based health insurance. These are all other qualifying life events that can open a special enrollment period for you. Now, really important, if you are seeking coverage and you don't have it right now, really, really, really important is if one of these things happen, if you have a qualifying event, you need to report that within 30 days of it occurring. And then you have 60 days from the date of that qualifying event to select a new plan. So when you're going through this, payment and enrollment deadlines still apply. But again, the key numbers here are, 30 days, within 30 days of it occurring, and then you have 60 days from the date of that event to select a new plan. So going on to the next slide, I very quickly want to mention, who can apply through mahealthconnector.org. So I think Seamus pointed this out, but if you are looking for coverage through the state's Health Connector, you need to live in Massachusetts. You need to, on our side, you need to be a U.S. citizen, U.S. national, or otherwise lawfully present in the U.S. And you need to be someone that does not have access to health insurance. So what does that mean? You don't have access to employer-sponsored insurance through your own job or a spouse's job or a partner's job. Now, if you are someone that is already enrolled in Medicare, Medicaid, the state's Mass Health program, or any other type of public health coverage, like certain veterans benefits, you're not going to be able to get coverage through mahealthconnector.org or get savings through us because you're already in another type of public health coverage program. Going on to the next slide, just some things you need to gather. So I recommend whenever anyone asks us, all right, what are the minimum things? What should I do? I always like to say, grab your a cup of coffee or a cup of tea, whatever it is you need to drink as you settle into to do this process. You're going to need social security numbers for everyone in your household who is applying. If there are immigration documents, any non-US citizens who are applying, you would need to gather those documents as well. We're also going to need to know about income information, particularly so that we can figure out if you can qualify for some savings. So if you are self-employed, we want to know about your net income. Let's see. Also, if you, oops, excuse me for one moment. Also, you know, if things are different, let's say you were working, previously you had a full-time position, but now in 2022, you recently launched this new small business. We're going to want documentation so that it doesn't, there's explanation about why your income was different last year going to this year. Now, another really important thing here is, this is a lot of information to gather. If you need health insurance coverage right away, we don't want to discourage you from applying. Just gather what you have, enter all that information in. If we need something else, we'll send you a letter asking for more information. And actually, as you're going through the online application, when you get to the end and it shows you your results, it will tell you if you need to send in any proofs, if the system wasn't able to match the information that you entered in the application. So throughout this presentation, we have a lot of links. So following this presentation, you will get a copy of this PowerPoint, and all these links are super helpful because they'll take you directly to more detailed FAQs on the state's Health Connector's website. So on to the next slide. I talked about this briefly in terms of ways in which you could get help paying for your premium through the Health Connector. So I had mentioned advanced premium tax credits. So the way this works is these tax credits lower the premium amount you pay each month. The IRS is going to send your tax credit directly to the insurance company, so you just simply pay the lower monthly premium each month. Now, if you are going through the application or even using the Get an Estimate tool and you see what it looks like could be your advanced premium tax credit amount, or when you're in the application, and let's say, for example, you're going to get a credit of $400 a month, you may say to yourself, you know what, I want to play it safe. I actually don't want to use that entire credit. I would rather, let's say, use only $300 of that $400 tax credit. So know that you can take the full amount or you can reduce that amount. And sometimes people will reduce that amount if they know their income is going to fluctuate throughout the year. They just want to play it safe. Because what's really important to remember or to know is that these advanced premium tax credits, these are federal tax credits. So when you file your federal tax credits at the end of the year or at the start of the new year, basically all of this gets reconciled. So just really, really important for people to have that understanding. I've also mentioned the Connector Care program. Now, the Connector Care program is able to offer lower monthly premiums because we're using federal advanced premium tax credits plus state dollars that help reduce the premium amount that you pay each month. So if you, in fact, qualify for these plans, these programs, these are very comprehensive plans. Again, low monthly premiums, low out-of-pocket costs, no deductibles, which is really key. Now, depending on the size of your family and other eligibility criteria, you could qualify for, you're going to find out which plan type you qualify for, but you could qualify for a plan as low as $0 or $135 a month. So it varies. We do have content at the end, and as in addition to that, I've mentioned this a few times, you do have the ability to go to our website. This is located on the homepage of mahealthconnector.org. In the upper, I believe it's the upper left-hand corner, it'll say get an estimate. And again, if you're looking for an estimate for the individual and family plans, choose that. And you can type in some minimal information and you'll see what your costs may be. Okay, going on to the next slide. This slide is important because I'm sure some of you are wondering, okay, so there must be some type of income guideline. Now, for the Connector Care program, as you can see on this chart, it's going to be dependent on your household size, as well as income. So for example, if you had a family of 3 and you were making $65,160 or less, that would, and you met all the other eligibility requirements, you could in fact qualify for a Connector Care plan. Again, low premiums, no deductibles, low out-of-pocket costs. Now, I mentioned that, you shouldn't be, I was gonna say, you shouldn't hesitate to use our Get an Estimate tool, estimator tool, because through the American Rescue Plan, one of the things that happened was the income limits to qualify for advanced premium tax credits went away. So there is a different calculation that is used. So essentially, people with incomes over 400% of FPL may now be eligible for federal help paying for their health coverage. So I can't encourage you enough to use the Get an Estimate tool to find out if that could be you. On to the next slide here. Seamus talked a bit about this in terms of being able to get free enrollment assistance. So with Health Connector for Business, you can contact customer service, or you can contact a certified broker and they can help you with Health Connector for Business. On the individual and family side, we have a separate customer service department, and the number is 877-623-6765. We also have a TTY number, etc. And if you're looking for the most up-to-date hours of operation, that information is also available from our homepage. But in addition to customer service, we have community partners that are out there available to help someone. So these people are trained and certified. They're known as navigators or certified application counselors, and many speak more than one language. They can help you from application through enrollment into health insurance plans. So particularly now, as we're nearing open enrollment and they're nearing a busy time, as well as, people are still being thoughtful about COVID and have their own precautions. We encourage everyone to call ahead to schedule an appointment for help. And again, when you get this presentation, or I believe my colleague Emily is posting links into the chat, you can click on the link that says Get Free Help Near You. You could put in your zip code, and even if there's a language other than English that you would like some help in, you can see, you can look for a navigator who may be able to help you in another language. So on to the next slide. Seamus, I'll start this off and then I'll hand this to you to bring this home, if that's okay.
Sure, that'll work.
Okay, great. So here, just want to remind everybody that, if you are an owner, small business owner, and you do not qualify for coverage on Health Connector for Business, you may be able to get coverage on mahealthconnector.org. So just again, to remind you of the deadlines, If you're seeking coverage for October 1, you're going to need to apply, enroll, and pay your first premium by the 23rd of this month. So you would need to do all of this by September 23rd, so your coverage can start on October 1. And technically speaking, I always like to let people know that you can also choose to have your coverage start on the second month. So if you want, we're looking for coverage to start on November 1, that is also an option. And Seamus, I'll hand the baton over to you.
Great, thank you. Okay, so if you're going to come in for small business coverage, you can purchase it at any month of the year. You can come in at any time, any month that you want to start your plan, so it doesn't always have to be at a certain time of the year. The 10th of the month is the deadline for an employer to create an account, upload all full-time employee information, quarterly wage documents, and then selecting their benefit package. We call it publishing it. And then that starts, that's all done through the employer account. And then by the 20th, that would be the deadline for employees to create accounts to enroll or waive into coverage. And we say valid waiver. So that would be, they'll get a drop down of reasons why they would want to waive. And we need employees to do this so that they can get their coverage to start, but also with a valid waiver, they'll be able to preserve their rights to come in at a later time of the year if they need to enroll, if they say they lost coverage through a spouse or something. And then the 23rd is going to be the deadline to pay, and that's your initial binder payment must be paid online in the billing portal or over the phone. Please don't send checks because they won't get there in time for the 23rd. So that payment does need to be made either online or over the phone with customer service. So yeah, I think we can move on to questions.
Great, thank you. So we do have a few questions that have come in. So if a covered employee leaves employment, does the Health Connector help with COBRA notifications, or does the business manage any COBRA needs?
Sure. So the COBRA actually falls under the responsibility of the business to manage that. You can initiate COBRA in your employer account, and then the employees will enroll or waive. You will receive as the employer a bill listing all your current employees as well as yours on COBRA, and you will have to make that payment. So you'll be responsible for collecting the money from your former employee, and then we will send you one bill where you'll need to make the payment. There are noticing obligations on employers, and that's something that the employers would need to do between them and their employees in order to give the employees adequate notification, et cetera. But you will start it in your employer account, then the employees will enroll or waive, and you'll be able to see once they enroll into COBRA the date, and it'll show that they're like COBRA. There's like a marking that shows that they're in the COBRA account.
Great, thank you. And Nikki, we might bring you back on for this question as well, but Seamus, don't go too far. If someone is running their own business and they have no employees, just to clarify, they need to have a qualifying circumstance or event to enroll in coverage. I know Seamus was talking about being able to enroll in Health Connector for business at any time. Can you clarify just again the difference between the individual and the business side?
Absolutely. So Erin, just as you said, for Health Connector for business, you can apply at any time during the year. For if you're an individual or family, or if you're looking for coverage for an individual or family, you would either need to shop during our open enrollment period, which starts on November 1, and this is for coverage that begins on January 1, or just simply apply and see if you have a qualifying life event that will open a special enrollment period.
Great, thank you. And Seamus, we're going to bounce it back to you. So when we're looking at the different, the flexible choice options, is one carrier the only option if somebody has an out-of-state employee?
Yeah, one carrier is where you're going to be able to get the PPO options, which would allow employees to get services in other states. There are some of the health plans have minimal coverage outside of the PPOs right over the borders, but they're not that extensive. So you would need to offer the PPO in order for the employees to reap the full benefit of seeking services outside of state.
Great, thank you. And when we talk about the ConnectWell program, you mentioned that there's a $100 Visa gift card. And does that go to each employee per activity, or is it just one gift card? How does that work?
Sure. So it's one gift card that they'll receive after they submit their documentation that they participated in improved wellness.
And so how many activities does an employee need to complete in order to satisfy the requirement?
They would just need to do one of the required activities and have proof of it. Okay. For example, a gym membership, sometimes people will send us a copy of their membership card, but we actually need something more concrete like payments, right? That you've been making your payment for your gym membership, not just that you have a gym card. And I think that's one of the most common things that we have to address.
And so when we were talking about the flexible choice models, can you provide some details or the differences between list billing and composite billing? What does that mean practically? Sure.
So in composite billing, which is the conventional way that things are done for small businesses, so this would be for one plan where everybody gets into the same plan. The composite bill rolls up takes into account all of the ages and charges the same amount for one employee, the same amount for an employee and spouse, the same amount for an employee and children, and the same amount for a family plan. So each employee, if they're on their own, is charged the exact same amount. In the list billing, which is under the one carrier and the one level, everybody is rated on their own based on their ages. So if both Nikki and I were enrolled that way, we would have a different rate because one of us is older than the other, I think. But if Nikki and I were in the one plan where there's the composite billing, and we would have the exact same rate because they would merge our ages together.
Excellent, thank you. And so this might be a question both of you can kind of weigh in on, depending on the response, but what would make a small business not eligible to use the Health Connector?
Sure. So the eligibility criteria to come on through the Health Connector for business side of the platform, which is what I've been talking about, is fewer than 50 employees. The business must be located in Massachusetts. So the zip code of the business must be in Massachusetts. So if you had a Massachusetts business on the Rhode Island border, people can live in Rhode Island, but as long as the business is in Massachusetts, they can come in through us. So under 50, business zip code in Massachusetts, and has at least one non-owner. So that's what knocks out the sole proprietors. They need to go to the individual side.
And so then, Nikki, I'll toss it your way. As a sole proprietor, anything you want to add about the individual side? And we also have an interest just on best way to get help as a sole proprietor.
Yeah, so I mean, I think Seamus covered all of the requirements for getting coverage through HCB. But I guess maybe what I'd say for sole proprietors is if you, maybe this is for anybody who needs coverage. If you need it, don't wait. Just if you feel comfortable completing an online application and you have, the information that I stepped through, I would say, sit down. Well, first I'd say go to our Get an Estimate tool, because I think that might motivate someone to sit down and start their application. If someone isn't, really comfortable, or quite honestly, you just don't have a whole lot of free time because you've started this new business, or you're running this own business, free help is always available, and these folks are knowledgeable. They've been doing this for years. Certainly contact one of our, I'd like to say, I like to promote our navigator organizations just because they're our grantees. But yes, and because of, because of the pandemic, they have a ton of flexibility. You don't necessarily need to go in person to get help. You could do a phone appointment, a Zoom appointment, whatever you feel most comfortable doing.
Great. So that's on the individual side of the website.
Yep.
Find local help. You can find navigators, contact information, and then there's always our customer service center.
Yes, absolutely.
Great. Just a few more questions before we wrap up. When we are talking about the one plan option, is this something that if an employer chooses one plan, that they could still offer different levels, or I should say, if they want to offer just to the employee, or maybe the employee and their family, or an employee and just the spouse? Is that something that they're able to do through the one plan option?
Yes, when they set up their account for the year, they would choose to offer coverage to employees or dependents, and then they can decide what the percent that they want to contribute to those as well. So we will see some businesses that only offer coverage to employees. They don't offer any coverage to dependents. We'll see some that offer coverage to both and offer the same amount. But the minimum, if you're going to offer coverage to employees, is 50% of the cost the employer must contribute. And then if it's dependents, it's 33%.
Okay, and so those different options, it doesn't matter what plan or what flexible option the employer chooses, that is something available across all flexible options.
Yes, yep, they can decide if they want to offer it to the dependents or just the employees.
Great. And then for the wellness benefit, ConnectWell, 33% participation that was referenced. Is that for the whole company or just the people who are enrolled on the health plan? So in order to be eligible for the rebate, how many, like what percentage of employees, when it says 33%, do they have to be just employees or enrolled in the health plan?
I must admit, I don't know the answer to that.
All right, we can go ahead, Nikki.
Yes, and I was going to say, I believe, we can confirm, but I believe it is those who are enrolled.
Yeah, I think it is the enrolled because that's what we base it off of, but maybe we can get a more detailed, specific answer. I'm sorry.
We can certainly follow up with that information. It's a great question, clearly. And when we're talking about kind of getting assistance, is there a cost involved with using a broker to decide kind of what the right coverage or plan might be for your business and employees?
Can you say that again, Erin?
Sure. Is there a cost associated with using a broker? Does
No.
an employee? Okay.
No, the brokers are free. They get separate commissions through us.
Great. And I'll just also drive home that if you're looking for individual coverage, Navigator support is also free. So come to the Health Connector for all your needs, and it will be free assistance.
Thank you, Erin.
It's a great resource. So let's see. So will we be sharing our slides at the end of this session? And I believe the answer is yes. Everyone who has registered, we will send out an email in the next day or so, and this webinar will be included. It's also recorded, so it can be viewed later as well. So, and then one final question. This individual has a number of employees, but they're the only full-time employee. So does that make a difference regarding eligibility for the Health Connector? So there are more than just one sole proprietor, but those individuals aren't full-time.
So Seamus, do you recall the calculation? I don't remember it off the top of my head, but I believe we have a calculation where because I was actually thinking of an example where I believe it was a cleaning company had, 50 or 60 employees, but they were all part-time. But when you added them all together and did the calculation, they actually turned out to be less than.
Yep. Yeah, and that information does exist when you go through the application process. But I think, Erin, can you say the question again, though?
So essentially, say the owner is really the only full-time employee, but there are several other employees, but none of them individually are full-time. And so trying to understand if they're eligible for coverage through the Health Connector for Business to offer to their employees as well, even though they aren't full-time. So
Yep, they can offer it to part-time employees.
and then will they have to do that calculation to determine if they have one full-time employee beside themselves, or is that does that not apply here?
It would be caught through the application process, but I think the key thing here is that sole proprietor, one of those other employees must enroll for the sole proprietor to also be able to get coverage for themselves.
Okay, great. That's helpful too. And apologies, but one more question. I think this is our last question. So recognizing that price sensitivity is going to remain an issue, and not knowing if your employees might enroll based on the price, is there a way to get an accurate quote before kind of moving forward so your employees have an idea of what they might be contributing?
Yes, yep. There's two ways to get a quote. One is to go through a broker, and then the second one is that there's an anonymous browse feature that we have on the website where employers can go in and put in some basic information. They really just need to put in ages of employees and then decide which model they're going to do, and that way they'd be able to see what the pricing would be. One of the important things to really get that figured out is if you know who is and isn't going to enroll, because if you offer the one plan, you will see a quote based off of everybody who you think is going to enroll. And if somebody who's, say, because that's the composite billing, so it's a combination of everybody's ages, if you suddenly have a bunch of younger employees who decide they're not going to enroll, at the end of the open enrollment period, it's going to recalculate based off of the ages who did enroll. So I think if you're going to go in and look for a quote and you're very conscious about how much you want to spend, it'd be very helpful to know who is going to enroll versus who's not going to enroll, so that you can get as close to as possible what the pricing would be.
Okay, and we are getting closer to one, and we did have another question come in, but I think it actually kind of plays off of that response. When you look at who's enrolling and age and differences, can you just revisit one last time, Seamus, for composite billing? Would everyone be charged the same amount, or would it be different based on the individual or based on if it's an employee and their spouse? How does composite billing play into that?
Yeah, so composite billing, if you're going to offer coverage to dependents, there'll be one price for all single employees. Every single employee will pay the same. And when I mean single, I mean they don't have any dependents. There'll be one price for all employees plus a spouse. And there'll be one price for all employees plus children, meaning there is no spouse. And then there'll be one price for all families. So all families, which would be, children, employee, and a spouse, gets put into the families.
Excellent. Thank you so much. And I lied but I promise this is the last one. Can you just review quickly on whether or not there are rules as to whether or not you need to offer a health plan to all employees, full or part-time? So is there a requirement about health insurance coverage and what must be done?
So yeah, if you're going to offer coverage to, say, all your full-time employees, they all must be able to access the coverage, and it has to be sort of the same benefit level. You can't sort of offer, X percent for these employees, X percent for those employees.
Okay, so equal across the board. Okay, excellent. Well, we had quite a few questions. They were all excellent questions, and we have a few items that we will certainly follow up on as part of that email when we send around the webinar. But thank you so much to everyone for joining today. Nikki and Seamus, if you have anything that you want to leave our audience with, I'll pass it over to you.
Yep, just a big thank you from our side, Seamus.
No, yeah, thank you for everybody, and for those on the business side. I think you're going to get some contact information, and again, you can come in at any time of the year. So if you're in a plan that works for you right now, but you're thinking of changing, you can come in at any time of the year.
Great. Thank you so much for joining us today, everyone. Have a great day.